Gauteng Emergency Medical Services has been dealing with a high number of medical cases during this festive season. So far, they've fielded more than 40,000 different cases, surpassing the number of cases reported in the same period last year. To discuss this, I'm now joined by Baloyi, who is the Communications Manager at the Gauteng EMS. A very good afternoon to you, Donald. Thanks very much for your time. More than 40,000 cases since the beginning of the holiday period. How does that compare to previous years?
Good day, Vuyo, and good day to your listeners. It is quite alarming, the number of calls we have seen so far compared to last year, and you can obviously see that there has been an increase in your trauma cases, but also in your medical-related cases, not only your trauma cases. And if I was just to give you a quick breakdown, comparing 2023 December and this year, we have seen last year trauma cases 13,058. This year we are already from the 1st to the 26th. We are already sitting at about 13,726. Which is a sharp increase of 666 calls already. And we still have about 4 days to go before the end of the year, which you are going to obviously see these cases going up. And the same as your medical cases. December 23, we have seen, and this was for the whole month, we have seen 26,915 cases. And compared to December this year, from the 1st to 26th of December, we have already seen 27,716 on medical cases, which is an increase of 800 cases already. And you will realize that come the 31st of December, these cases will have already gone above 30,000 cases, your medical cases, and your trauma will probably exceed about 20,000. And this year we might see ourselves with the entire month servicing or receiving more than 50,000 calls just this December.
Now, for those of us who are uninitiated, what are we talking about when we're talking about trauma? What are we talking about when we talk about medical cases?
All right. I want us to focus mostly on the trauma cases because of the festive season. But your medical cases, you're referring to your hypertension, your diabetes, all those medical conditions. Your allergic reactions. But the festive season, we see mostly trauma-related cases. And I just want to give you a quick breakdown and a comparison from last year, 2023, and this year already, and just to show you the sharp increase. So, for example, your assault cases, in Johannesburg last year, we have seen 920 trauma cases, assault, referring to either your blunt trauma or your bleeding, could have been your stabbings, and December 2023 was 920. And then so far this year, we are already sitting at 1,892, and this is in Johannesburg alone. And it gets worse. You look at Ekurhuleni, the city of Ekurhuleni. Last year, and this was the entire month, we serviced 1,065 cases. And already to date, in 2024, we have exceeded that number. We're sitting at 1,992 assault cases. So you can see that sharp increase, and it extends to all your districts. including the city of Tshwane. They are sitting at 1,111 already from 521 last year. So you can see that there's been a sharp increase in your assault cases. And then if we compare the shootings, for example, from 2023 and 2024, in Johannesburg again, last year we received 174 shootings. This year we're sitting at already 283, and this is Johannesburg alone. Then you move to city of Ekurhuleni. Last year, December, we received 118 cases of shooting. This year, we're already sitting at 195 from the 1st to the 26th. And then in the city of Tshwane, last year it was 55 shootings. This year we are already sitting at 61. So you can see all the districts, including Sedibeng. Sedibeng last year was 32. This year to date is 39. So there's already an increase of 7 cases already. And the West Rand, it's a bit stagnant. Last year it was 38 shootings, and then this year so far it's 35. And we're really hoping that we can avoid all these assaults and all these shootings and keep it at whatever number it's sitting.
Okay.
And then yes, just one last thing, Vuyo. The motor vehicle accidents also this year there's a sharp increase overall in terms of accidents. And Johannesburg, the city of Johannesburg, we see a lot of accident in that district or in the city, with 601 today from 466 last year. And already in the 26 days, we are already sitting at 601. Then in Ekurhuleni, in the city of Ekurhuleni, there's also an increase of accidents, but slightly below, just slightly below your Johannesburg. So Ekurhuleni is sitting at 490 to date from the 1st to the 26th. And then last year, we overall in December in Ekurhuleni, it was 443. I'm just trying to paint a picture here, Vuyo, that the accidents are also increasing, gradually each year in the festive seasons.
Are you able to tell us, as a parting shot, whether, in fact, the facilities all these people get referred to are able to cope with these increasing numbers?
It really depends, Vuyo, on which day. For example, yesterday, it was one of the busiest days in the entire province, Boxing Day, which everyone goes out to have fun. So we have seen an increase yesterday and pressure. But remember that the facilities would see also your medical cases as well. They are not only focusing on your trauma cases, so they would attend to either trauma or medical cases. And then they would then try and serve and separate the patients to your trauma unit and your medical unit in the facilities, just so that they can be able to focus specifically on each either surgical related emergencies and then medical related emergencies in that way. It does put a bit of pressure, because some of these incidents could be avoided if we were to look at it realistically. So it does somehow put pressure on the facilities. But I have trust in the Gauteng health institutions. I know that they're able to then, come up with ways and systems of either down referring some of the patients, to make space to accommodate your more critical cases, but also to try and avoid hospital diversions so that it doesn't have a ripple effect in the entire province or whichever district you are in. So say, for example, if you are in Johannesburg, they will try to avoid closing off most of the hospitals, but rather create space and triage and those non-urgent cases, try and get them out as quick as possible, meaning discharge those that do not need admissions, so that when you receive your most important critical cases, then you are able to cope with the pressure.
Donald Baloyi, let me thank you very much for your time, giving us an update on how Gauteng Emergency Medical Services has been doing this festive season. More than 40,000 cases is what they have had to deal with. We're talking about trauma that includes your assaults, your stabbings, and your shootings, but we're also talking about medical cases, your hypertensions, your diabetes, and the like. Across the board, there is an increase, and in many instances, a very sharp increase compared to previous years, something we should all be concerned about.